it did, and it is flawed for those reasons. Now let's begin to share a little blame. Pro-free market and healthcare reform advocates who believe that choice and competition are the answer blew it. We failed during the Bush presidency to offer our own plan following the failure of Hillary Care, and when Obamacare became the topic before the nation, we failed to respond with a plan of our own. We cannot let that happen again. Let me illustrate that point. Inside the Congress, there was a heated debate between myself and a number of the other chairs of the subcommittees on health care, including Mr. Camp and others, about what we would put in a Republican package. But you know what? We fell victim to the often repeated argument in the minority that as soon as we surface an idea, they'll have something else to shoot at. I think that was a mistake, but here's how far we let it guide us. Republicans offered their alternative to Obamacare 2 days before the final vote. I think that said to the nation, Republicans weren't very serious about how to fix health care. It has indeed, as passed, I think, as you all know, massive shortcomings. Its promise that it will bring down the cost of health care is simply flat false. Indeed, literally every promise made about the health care inside the bill that it would fix things is false. That gives us a second chance, and I would suggest we have to seize that second chance. Rarely in life do you get a second chance. For those of you, I think, in the room who represent various sectors of the healthcare community, whether it's doctors, health insurance companies, hospitals, or other players in the field, I think all of you, indeed perhaps all of us, came to the table in good faith and in goodwill. And I think the bill betrays that good faith. And that suggests to me that, in my view, delaying the implementation of the bill, attacking its most outrageous failing provisions, and then ultimately repealing it is essential, but it's not enough. It's not enough because you can't beat something with nothing. We owe it to the American people to explain to them that we can give them something better. And I will tell you, I think we can give them something better. And I don't think it's rocket science. The reality is, if you look at healthcare in America today, the biggest problem is that costs are skyrocketing. Now, there are those who will tell you that costs are skyrocketing because too few people buy insurance. Really? I would suggest it's the opposite. The reason too few people buy insurance is because costs are skyrocketing. So if costs are skyrocketing, what is the reason for them skyrocketing? What causes that? Again, I would suggest to you it's not rocket science. If you look at the health insurance market in America today, it is a non-functioning market. There is indeed virtually no competition. Name a product that your employer buys for you other than your health care. Does your employer buy your automobile? Does he buy your home insurance? Does your employer buy your shoes? The federal government didn't pick out these shoes for me. I would suggest to you that as well-intentioned as employer-based health care was when it was initiated, and it did a lot of good, it got lots of people insured, at the end of the day it contained within its design the seeds of its own destruction. And the seeds of those own destruction are, if you can't go buy the product, you can't price shop, you can't force competition, and at the end of the day, if it mistreats you, you can't even fire it. I tell this to lots of audiences, and they say, oh, Congressman, it's much more complicated than that. Health insurance is way too complicated to leave to market forces. Well, I would suggest to you that if you believe in health care reform and you do not want a single payer system or a massive government regulatory program like the one Obamacare creates, then you need to rethink that thought. Because the reality is, study the current situation in America and you will find that there is virtually no competition. The market is plagued by a number of things that cause no competition. The first and the foremost is the fact that the tax code makes it near impossible to reasonably buy health insurance other than through your employer. So you've delegated the most important decision to somebody else to make. You can't price shop, you can't hold it accountable when it fails you, and there is no price competition created by just a handful of employers who are trying to get the price down. Interestingly, I used to tell the story that if Shirley and I had created an account at the local 7-Eleven for our kids and said, we're going to go down there and establish an account, and you kids go down there and anytime you want a Slurpee, or anytime you want an ice cream bar, or a big Coke in the summertime in Phoenix when it's hot, just go down and order it. Well, that's what employer-based health care in America does. What a shock that costs would go up. Instead, Shirley and I would say, as I assume most of you did, Here's your allowance. You get $2 a week. If you spend it on a Coke the first day, you're out for the next 6. And yet, that's not what we do in America. Why else is it too expensive? Well, one of the ideas I put on the market a number of years back when Denny Hastert was Speaker was the notion of interstate purchase of health care. The reality is that because we allow states to regulate all the health insurance in their individual jurisdiction in the individual market, we have created 50 little fiefdoms forcing insurance companies to write 50 separate little products and preventing them from competing. The effect of that is not very complicated. If there's anybody in the room from the Blues, I don't blame them for doing what they've done, which is to become the insurance marketer of choice, offering probably the best plan in all 50 states. But the reality is they have, in some states, as few as 2 or 3 other competitors. Well, if you have only 2 or 3 competitors in a marketplace, you are not going to get genuine price competition. And I believe that's an essential element of healthcare reform that we need to enact, and we need to enact very, very quickly. For those of you that are state legislators, it's very interesting that you, in this case, don't have to wait for the federal government. As massive and as egotistical as it is, it has not yet precluded you from passing a law at the state level, which would say we'll allow the sale of an insurance policy written in any one of the other 50 states to be sold in our state. Or you could say in 45 of the other states. We've looked at 5 and we don't like their policies, but the other 45 we will. What would happen immediately is that there would be competition because the insurers in your state would go to some other state which offers a more basic, less expensive policy without all the individual policy mandates in it covering hair prostheses and every other kind of treatment that you might but probably don't need, alcoholism treatment if you happen to live in Utah. They would find a policy that doesn't cover those, that is less expensive, and they'd bring it back and they'd sell it in your state. You know how I know that? When I first introduced the idea, the Blues in America became very upset. They put out a flyer attacking my bill, and I called the Blues in Arizona and said, look, I don't mind the opinions expressed in this flyer, but I don't really like the lies. And I said, I want you as the Blues of Arizona to get them out. And so the Blues in Arizona fought with the National Blue Association, and they came back and fixed the flyer. And then I was told that if in fact my bill ever became law, that Arizona insurance companies already knew what state they'd go to identify a basic policy, bring it back to Arizona, and sell it in Arizona. By the way, the law required that there be financial solvency at a kind of platinum standard so that every policy had to meet standards of solvency, and it allowed an appeals process that was identical in all 50 states so that if you were wrongfully or you believed you were wrongfully denied care, you could appeal the decision. And it was regulated by the state where the consumer lived, not the state where the insurance company was domiciled. There are things that we can do. I could talk at much greater length. Obviously, I will tell you that because we did not convince enough Americans that there is a way to solve the problem